What's up, guys? Dr. John Schaefer, physical therapist, strength conditioning coach here. Today, we're covering adhesive capsulitis, better known as frozen shoulder. We'll briefly cover the risk factors, the causes, how this thing progresses, and I'll share some of my go-to exercises as well as some of the most common ways that these exercises are not performed correctly. And my goal is to leave you feeling more confident and understanding what the heck is going on when you hear about the term frozen shoulder. This pathology, honestly, it's a tough one, but I hope to leave you with some additional insight and some peace of mind so you can feel a lot more comfortable tackling this thing. As always, my videos are for educational and entertainment purposes only. They're not direct medical advice. Like and subscribe to the channel helps me keep putting out this great content. So let's dive right in. Adhesive capsulitis or frozen shoulder happens for a variety of reasons, and for the most part, unfortunately, it's largely misunderstood. But some of the most common reasons one might have frozen shoulder include maintaining the shoulder in one position for a prolonged period of time. Think someone who maybe just had a big shoulder surgery, they haven't moved it around a lot, it's been in one spot for a while. Other reasons can include cancer treatments, comorbidities such as diabetes, changes in hormones, or honestly for no reason at all, which is the most puzzling and extremely frustrating thing for a lot of patients to hear. They think to themselves, what did I do to deserve frozen shoulder? Why is this happening to me? It's still something we're doing a lot of studying, we're doing a lot of research to try and figure out, what are some of the causes and why are people experiencing this? But when you are experiencing it, it's important that you understand that there's a couple different stages that someone goes through when they have frozen shoulder. The first stage, known as the freezing stage, occurs when someone starts to lose some of that motion. It's a very, very painful. Any kind of movement, lifting the arm, is not going to feel great. So during this phase, people are in a ton of pain, like 8, 9, 10 out of 10. People saying that they're breaking the pain scale. They don't want to move their shoulder because it's so uncomfortable. What's happening in this phase is that capsule is tightening up a little bit. Once we get into stage 2, that's the frozen stage. During this stage, patients will actually start to experience some relief. So things are going to start feeling a little bit better, but in terms of motion, they're still not having a lot of motion. So whatever motion that the patient has during the freezing stage, oftentimes we try and maximize that motion there, because once you get to the frozen stage, you're not getting that motion back, at least for a little while. And then lastly, we get to stage number 3. This is the one that everyone's waiting for. Everyone wants to speed up and get to this point in recovery, because once you get to stage 3, that's the thawing phase. So this is where you begin to regain that motion slowly. And this can occur, unfortunately, anywhere from 12 to 24 months after the initial onset. So that can be, almost up to 2 years. So that's why it's so important that you're patient with yourself and you understand this timeline so you don't get overly frustrated during the process. But the good news is this thing does resolve. So if you just hang in there, find a good physical therapist, find a doctor who is able to explain these things to you, and it'll just make the process that much easier, and you won't be guessing, you won't be wondering, you'll just feel a lot more confident throughout the process. So for these patients, especially in stage 1, it is so important to work on improving and maximizing that motion, but doing so within a pain-free range. So what that means is the goal is not to push into pain and try and get as much as you possibly can with these exercises. It's simply to find movements that are comfortable and that the patient is able to perform. So let's dive into some exercises that typically work pretty well for patients. The most common exercise that's going to be prescribed is going to be the pendulums. This exercise requires the individual to use their body weight to swing their shoulder in a variety of motions while supporting their body with their other hand. So really, this exercise is just about getting the arm moving, working through some different positions without straining the arm, without actively moving the arm. So it's very important that the body is moving during the motion and that you're not simply swinging your arm without moving your body. That's one of the most common mistakes that I see in clinic, and one that can lead to increases in discomfort. A lot of times a patient will say, I felt so good doing this exercise in clinic. I went home, I did that exercise, and it's causing me all kinds of pain now. And the reason is, if you're just moving your arm and not using your body, that's going to put a lot more stress on the shoulder. So some different ways this exercise can be performed. You're going to want to perform it in a circle, as you see here, as well as moving forward and backwards. So kind of rocking your body forward, rocking your body backward, using that momentum to get that arm moving. And then finally, you're going to work on side to side as well. This should not increase your symptoms at all. And this can be performed for 1 to 2 minutes at a time to start. And if that's tolerable, then I typically have my patients gradually increase the time a little bit as comfortable. But this is something I have them do a lot throughout the day. So typically start maybe once in the morning, once at night. If that's easy, bump it up to 3. If that's still easy, you just continue to kind of build on it. That's the big thing. You're gradually adding a little bit more, always within that pain-free range. The next exercise that I typically like to use for these patients is the towel slide. For this exercise, the patient will sit in a chair with their arm outstretched on a table. Kitchen tables usually work very well. And again, using the body, that's a big theme throughout all these exercises. Using your body weight to shift the arm forward and then come backwards. But a major key, once again, you're moving it within that comfortable range. So if it's painful, you're doing too much. Move through a range of motion that's a little bit less, that's comfortable, that's tolerable. I promise these patients are able to get more motion over time, but it's important that you start slowly. It's important that you take your time and are not jamming into painful motions. This is not a situation where, moving through a lot of pain is going to help you. It won't. After performing this exercise, moving forward and backwards, I typically have the patients repeat this exercise. This time you're going to rotate the chair and use your body to bring their arm out to the side and then back in. So that's working on the motion out to the side, whereas that first exercise is working on that motion of reaching out front. For both the towel slide exercises, I'm usually prescribing about 20 repetitions at a time with 5 to 10 second holds, depending on how well the patient can tolerate. So if they can't tolerate very well, I might have them move a little bit quicker, and I might have them do less repetitions from a lower range. Compared to someone who's absolutely crushing it, able to do pretty well, then I might add in some additional holds. Then lastly, I always like to add in just a little bit of scapular strengthening, parascapular strengthening. Basically, that's just the muscles around your shoulders. So we want to wake those muscles up, especially if this is an individual who has, held their arm at the side for a long period of time, is coming off of surgery or anything like that, where they haven't been moving a ton. Then it's going to be super important to add in these exercises. So 2 exercises I really like that are usually tolerable are going to be scapular squeezes, where the patient tries to take their shoulder blades and squeeze them together. And I usually like to hold for about 3 to 5 seconds. If they're not tolerating that well, you can decrease the hold to a little bit less. And if they are tolerating well, you can actually add in a band too and have them pull that band apart while they're squeezing. And then the second exercise is going to be a scapular shrug, where the patient simply raises their shoulders and then brings them back down. So that's going to help a lot with the muscles on the top of the shoulder, whereas the previous exercise is going to help with the muscles on the back of the shoulder. But the goal of both these is simply to get a little bit of shoulder muscle activation, especially if the patient has not been active or they've been doing a lot of guarding their shoulder. Depending on the response to treatment, there are a lot of ways we can progress these exercises, but this is almost always how I like to start patients who are lacking shoulder mobility, especially if they're very painful and I'm suspicious of frozen shoulder. If you go and see a physical therapist, if you see an orthopedic doctor, they're going to be able to tell if it's frozen shoulder very quickly. There's a capsular pattern we look for. There's different tests we can do. So if you have any questions or concerns, schedule that appointment, reach out with a medical provider who can give you tailored insight. This is only a video, an educational video on YouTube. So although it can be a helpful start, highly encourage you to go see a medical provider. But again, I mentioned this pathology is a tough one. It's a long process. You want to give, if you're a medical provider, give your patients some grace and recognize this is not an easy thing to deal with. And if you're a patient, just know things are going to get better. Just be patient with yourself, understand the process, the overall timeline, and that you're going to see improvement. It's going to take some time. Drop any questions or thoughts in the comments. I'd love to hear from you, your experience, what's worked, what hasn't. And yeah, I really hope that, you're hanging in there, and that this thing's going to get better. So like and subscribe to the video if you got some good value from it. I look forward to continuing to put out good content. And yeah, reach out to your physical therapist, reach out to your doctors, and let's take care of this thing. Let's get you feeling a little bit better. Thanks. We'll see you on the next one.